Hello, everyone, and welcome to another webinar in our Health Reform Beyond the Basics webinar series. This is Hallie Cloud, and thank you so much for joining us today. For those of you who are new to our webinar series, this is a project of the Center on Budget and Policy Priorities, which is a nonprofit policy think tank in DC. This series is designed to help advocates, assisters, state and local officials, and others assist people access and understand the Affordable Care Act's health coverage options. It is intended for those working on the implementation of health reform and is not intended for press purposes. Today, we are pleased to host a special presentation by Carl Cooper, Director of Public Health Programs at the American Association on Health and Disability. This webinar will help you think about what questions a person with a disability needs to think about when they are considering their healthcare options in the marketplace, and it will provide an introduction to the resources available through the National Disability Navigator Resource Collaborative. Additionally, it will address disability etiquette and basic accessibility considerations for anyone doing enrollment work. So with that, to guide us through today's topic, please welcome Carl Cooper from the American Association on Health and Disability.
Thanks, Hallie. My name is Carl Cooper. I'm the Director of Public Health Programs at the American Association on Health and Disability. For those of you who are not familiar with our organization, we are a cross-disability disability organization that deals with stated mission of promoting health and wellness for people with disabilities. We're located right outside of Washington, D.C. in Rockville, Maryland. And we're cross-disability, so we work in all fields of disability, whether it's physical disability, intellectual, developmental disabilities, and mental health. So all those issues you'll see as I'm talking today that we're dealing with a lot of different areas of disability, and that's our organization is cross-disability, so we cover all of those. We work through our mission statement through four main objectives. We work to reduce health disparities. We advocate for community inclusion, so including people with disabilities in health programs. Also promoting full accessibility so that people with disabilities can effectively use the services that are available to them and are able to benefit from those. And we work to integrate disability into the broader public health agenda. In terms of health disparities, I think it's important as you're helping people with disabilities that you understand the population a little bit. So I do want to just talk about health disparities among people with disabilities for a moment. One of the questions I get very often is, how exactly are you defining disability? And there are several different definitions depending on what you're doing. You could have the broadest definition of disability, which is, for instance, a definition that's included with the Americans with Disabilities Act, or you could have a much more restrictive definition of disability, which is one that would be, say, for instance, people that are trying to apply for Social Security disability benefits. So obviously, they're very different definitions of disability, and depending on what definition you're using, does determine, how many people then are in the population. For the purposes of this discussion that I'm going to be doing now, I'm going to be using a definition that HHS used for these statistics I'll be giving you, which is the section of the population where they have a disability which seriously limits them. And that makes up 12.5% of the population, so 1 in 8. When you hear the more common statistic given of 1 in 5 people have a disability, that's using the broader definition that you would find under the Americans with Disabilities Act. But for purposes of these statistics today, I'm using a little bit more restrictive, not quite as restrictive as, say, for Social Security disability, but one that's sort of in between those two. So with that in mind, there are some interesting facts as it relates to people with disabilities and their health. So people with disabilities are over twice as likely to not see a doctor due to cost. They're over 30% more likely to be obese. They're 60% more likely to smoke. And they're over 2.5 times more likely to develop diabetes. So you can already see that there are several factors that are going to be going against the person with a disability as it relates to their health. Then we're talking about some of the basic screening. So women with a disability are less likely to have a current mammogram, and they're also less likely to have a current Pap test. When you're looking at health conditions as a whole, people with a disability are over 3.5 times more likely to have cardiovascular disease in the age group of 18 to 44, so younger adults. When you get into the older, the sort of the middle age to older adults, when you're talking from 45 up to retirement age, they're just under 3 times more likely to have cardiovascular disease. So the disparity does shrink a little bit, but that, of course, is not because people with disabilities are getting more healthy. It has to do with the fact that their counterparts are getting less healthy and are having more of a problem with cardiovascular disease. There are several social determinants of health that sort of play into all of this. So people with disabilities have double the unemployment rate among those within the workforce, and that's a key distinction among those within the workforce. We're not talking about people that cannot work, that are on Social Security disability and are unable to work. We're talking about people that are able to work, that are actively seeking employment. For those folks, people with disabilities have double the unemployment rate than those that do not have a disability. And that pretty much stays constant regardless of the economic situation that goes on. So for instance, when the Great Recession hit in the 2008-2009, the unemployment rate for everyone went up, and it went up and stayed sort of double the unemployment rate for those people with disabilities. And as it got better, it also got better for people with disabilities, but still pretty much maintained that statistic of being double the unemployment rate among those within the workforce. So it's important to know that, because that does obviously then affect the ability to earn wages and all those types of things when you're looking at folks in terms of what their options are for premium tax credits or Medicaid expansion. They're about 35% more likely to have less than a high school education, and people with disabilities are also less likely to report sufficient social and emotional support, which is important because that's then going to determine whether or not if they're more likely then to follow up with a doctor's appointment or to stay consistent with their medications and all those types of things. If they don't have that support around them, those things are much less likely to happen. I put this slide up here just to really drive home a point, and that is that there is a difference when you have a population of people who have a disability and older adults. And lots of times those go hand in hand, lots of times they're different. So this chart really sort of shows how the population of people with disabilities the percentage gets much higher as people get older. No real surprise there, because as people get older, they develop conditions which are disabling. The key thing to know, though, is that it does then create sort of two different sets of populations among people with disabilities. You have those that either are born with a disability or they acquire their disability early in life, versus those who acquire a disability later in life. And the important distinction there is the fact that people with disabilities who are born with them usually have much higher expectations as to what they can accomplish, what they can do, what they expect. So they're much more likely to expect that they're going to be able to completely use a doctor's office and be able to have all the tests done like everybody else does, and they're going to be able to maintain sort of that same consistent and healthy approach to life that everybody else would. Whereas people who get older and acquire a disability later in life, lots of times they have more of a defeatist attitude with the idea of being, well, that's just what happens when you get old. So those people may view their disabilities very differently. That's also important then when you're meeting with them as it relates to what they're going to expect from your services. And whether or not things are going to be, for instance, in an alternative format that they can read if they are blind or low vision. Lots of times people that are older, that happens to them, they sort of have the idea, well, that's just what happens when you reach my age, whereas those that either were blind from birth or they became blind earlier in their lives are going to sort of have adapted and expect that they're going to be able to use everything that anyone else would. So that is going to be a very different interaction you're going to have with those different sets of people with disabilities and the various and very differing populations within that group. The other thing I'll point out about this slide is all of the statistics I just provided you are from a journal article from the American Journal of Public Health. The site there is at the bottom of this slide if you're interested in learning more about some of the health disparities and the statistics that go into that. I didn't go through all of them. I just touched on several, but if you want to read more about that, I'd encourage you to check that out. Now, as it relates to the Affordable Care Act and people with disabilities, I think it's important to understand sort of the disability law timeline. So the very first disability law that was passed was the Rehabilitation Act in 1973. This is the first time any sort of disability discrimination is made illegal. The Rehabilitation Act only applies, though, to those organizations who are receiving federal funds. Now, that is important for navigators and the like, because if you are receiving funds through CMS, then the Rehabilitation Act does apply to you, whereas if you are an assister that receives no federal funding, then you're going to be governed more by the Americans with Disabilities Act, which talks broader about public services and the availability they need to have. So the Rehabilitation Act, though, is sort of the first law that sort of ends up really affecting the rights of people with disabilities and making it illegal for people to discriminate against someone just because they have a disability. The next act you have is the Individuals with Disabilities Education Act, or IDEA, which was passed in 1975. It had another name then, but that's how it is known now. In 1984, we had the Voting Accessibility for the Elderly and Handicapped Act. In 1986, the Air Carrier Access Act, which deals with transportation on airlines. The Fair Housing Act is amended in 1988 to include disability as a protected class. And then in 1990, the act that most people are familiar with, the Americans with Disabilities Act, is passed, and that deals with a broad range of areas. So it deals with public services, it deals with employment, it deals with public transportation, and all the areas that sort of are in the public life, and making it illegal for people to discriminate against people with disabilities, and making sure that they're making their facilities and the like accessible to them so that they can fully utilize public services. The reason I go through all this, though, is to point out that, you know, by 1990, then, we've dealt with education, we've dealt with voting, we've dealt with transportation, we've dealt with housing, we've dealt with employment. Basically, we've dealt with everything but healthcare. And healthcare is the one area that was sort of carved out from the Americans with Disabilities Act, and specifically because at the time it was determined that they thought it was going to be difficult to pass the law with that included. So they, rather than be held up and continue to and not pass a law just because one portion of it would become problematic, they decided to go ahead and pass the law anyway without it. But what that did mean is that insurance companies then were still allowed to discriminate against people with disabilities because they were not covered under the Americans with Disabilities Act. So it does sort of create this strange area of discrimination that still existed after the ADA and before the ACA. So what does the Affordable Care Act mean for people with disabilities? Well, it means no denial of coverage of pre-existing conditions, no cancellation of coverage due to serious medical conditions, and no setting premiums based on disability or chronic conditions. These three provisions together are what we refer to as the guaranteed issue clauses of the Affordable Care Act. Basically, anyone who wants coverage can get coverage. They can't cancel your coverage because you're starting to cost them too much, and they're not allowed to grade you based on and set your premiums based on your medical conditions, because otherwise, if they could do that, then the other two are really meaningless because they could price you out of the market. So it's important to understand that all three of those are sort of needed to really eliminate that discrimination that existed before the ACA. Some of the other things the Affordable Care Act did for people with disabilities, the no lifetime monetary caps was obviously very important to people with disabilities who honestly do cost more to the healthcare system than other individuals. The other important thing is 10 essential health benefits are required in every qualified health plan. And a lot of those are important to people with disabilities, including prescription drugs, medical devices, preventative services. And so all of those things are very important because, once again, if insurance companies can sort of carve out different areas and require people to pay extra for those services or buy a higher plan, then really you're getting right back to what they were doing before with setting premiums based on medical conditions if they were allowed to sort of carve out different areas of health coverage. So that's one of the reasons why the 10 essential health benefits are so important to people with disabilities. And then finally, the other thing that the Affordable Care Act did for people with disabilities is it put in place some Medicaid reforms. It expanded a program that existed before the Affordable Care Act called Money Follows the Person, and it also created the Balancing Incentive Program. Those two programs together, what they do is they really promote home and community-based services as the preferred way to speak over, excuse me, not speak, it allows them to use home and community-based services over institutional care. So that institutional care is sort of the thing that's automatically covered in traditional Medicaid, but many people with disabilities don't want to have to live in an institution or a skilled nursing facility just to receive care. They prefer to live in their homes with their families, and these particular provisions sort of allowed those programs to continue and really allowed states to then move people out of those skilled facilities and into the home and community-based services. First of all, where the people want to live in the first place, and secondly, it's usually much less costly to do it that way as well. And then finally, it created the alternative benefit plan, which allows states some a little bit of flexibility in designing their Medicaid programs and trying to figure out exactly what is available to those individuals. Now, what is the NDNRC? The NDNRC came out of a concern of some of the national disability organizations that navigators were not going to have a sufficient knowledge base to assist individuals with disabilities as they made healthcare enrollment decisions. Several of these organizations began discussing ways to reach out to the navigators, provide technical assistance, and better prepare them for assisting this population of consumers. It's estimated when the Affordable Care Act was passed in 2010 that 3.5 million people between the ages of 16 and 65 were uninsured and also had either pre-existing medical conditions and or disabilities. These individuals do face multiple options when they're enrolling for their health care coverage under the Affordable Care Act. This includes possible traditional Medicaid in their state, possible Medicaid buy-in in their state, possible Medicaid expansion in their state, and the exchange marketplace insurance coverage and all the possible plans that are available in the marketplace. So it's the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. So who makes up the NDNRC? It's led by a group of 10 national disability organizations, led by my organization, the American Association on Health and Disability. But we also have a lot of different organizations as well, including the Association of University Centers on Disabilities, Autism Speaks, the Christopher and Dana Reeve Foundation, the Disability Rights Education and Defense Fund, Family Voices, the National Alliance on Mental Illness, the National Multiple Sclerosis Society, the ARC, and the United Spinal Association. So as you can see, one of the main strengths of our collaborative is the cross-disability makeup of the partner organizations. As I said before, the mission then is to sort of provide that cross-disability support to the navigators to really sort of be able to provide guidance to you as you're assisting people with disabilities, and we are there then to act as a resource. One of the ways we do that is through our website, which you can find at www.nationaldisabilitynavigator.org, and all the resources that I'll be talking about today are available on that website. You can see this is a screenshot of the homepage, so there's several drop-down menus, which include the About Us, which has information about the partner organizations I mentioned. Conversations is where you can go to ask a question, frequently asked questions, our blog, archive news, announcements, and our newsletter that I'll be talking about in a moment. On the materials is where you can find a lot of the resources that I'll be talking about, the disability guide and fact sheets. And then you can see this, the large picture there is a slide which changes and has information about the disability guide, our fact sheets, our community outreach collaboratives, our partner organizations, the statement we put out on ACA when you're looking at different when they were looking at possibly repealing it and replacing it. You can see up at the top that there is an account and logout thing. When we first set up the website, there was a registration requirement that's lifted, so you don't even need to worry about that. You can fully use the website without having to do any of that. A little further down on the homepage, you'll come to our state resource guide map, where you can click on your state and receive state-specific information. You can also see that to the left there, we do have some social media as it relates to the NDNRC, so you can follow us on Twitter at NDNRC, the handle, and we also have a YouTube channel that I'll be talking about in a moment. But as it relates to the state resource guide, if you click on any of the states, it does take you then to a state-specific page where you can find information about the marketplace type, whether or not the state has expanded Medicaid, if it is a state-based marketplace, the contact information for that state. If it's a state that has one of our community outreach collaboratives, you can find that information, as well as information on the assistive technology programs, which can be of assistance many times to people with disabilities. And we also have some state-specific resources. We have state-specific resources for all the states. And in a couple of states, we do have some of the fact sheets that have been made state-specific. We saw earlier on, if you saw on the homepage, you saw there's a resources and links portion, and there are several categories of resources and links that we do have available. So our enrollment resources, which are disability specific. Many of these are from our partner organizations, such as a toolkit from the ARC or draft questions on rehabilitation and habilitation benefits from the American Occupational Therapy Association. We also have resources about mental health and behavioral health, which includes resources from SAMHSA, the National Council for Behavioral Health, and Mental Health America. Enrollment resources for populations with special health care needs deals with resources from organizations such as the American Heart Association or the National Health Council. The next two categories, the ACA Marketplace and Medicare and the ACA Marketplace and Medicaid, has resources from CMS as well as organizations that are specific to each of those programs. So, for instance, the National Council on Aging for Medicare, and the National Academy for State Health Policy for Medicaid. Our enrollment resources overview is our largest category. One of the resources that we always like to make sure that we promote there is the resource that's available for all navigators from the Georgetown University Center on Health Insurance Reforms, which is sort of a navigator guide that deals with a lot of different issues. It doesn't deal with disability. It deals with a lot of different issues on what you'll need to really assist individuals, and has an answer to a lot of technical questions regarding how premium tax credits work, how income's calculated, how you deal with people who have questions regarding their immigration status. All those types of things are dealt with in that Navigator guide. So if you're not familiar with that, I would encourage you to check that out. Our next category is our enrollment resources, which includes information put out regarding how many people have enrolled, and includes some of the latest Medicaid numbers as CMS puts those out. And then we also have ACA resources from the government and ACA resources from other enrollment organizations. The government one includes basic resources from healthcare.gov and HHS, and the other one includes resources from organizations that have been assisting and encouraging enrollment. As I mentioned earlier, one of the resources we are most excited about is our disability guide. It was released in December 2013 and was has been revised since then. It provides information to navigators and other enrollment specialists about special considerations people with disabilities face as they shop for healthcare coverage. At this point, I do want to point out that originally, for the first 3 years of this project, it started in October of 2013. So through last October, a year ago, we were funded by the Robert Wood Johnson Foundation, and they're the ones that made most of these resources available, so we're thankful to them for that. In terms of what's included in the disability guide, the introduction talks about how the disability guide is meant to supplement the training for navigators that's put out by CMS and sort of act as a disability 101 for helping people with enrollment. What are the purposes of the Supplemental Disability Guide? Provides the objectives of the guide is strengthening disability literacy, helping identify and provide appropriate accommodations, and assisting in identifying issues central to the healthcare of people with disabilities. Key questions for navigators is a basic overview of some of the important questions which are answered with the guide. Then you have who are people with disabilities and what problems and barriers of people with disabilities historically encountered when obtaining healthcare insurance. These two categories provide a basic background for those completely unfamiliar with who makes up the population of disabilities and the historic disparities that they have faced in healthcare. How do disability rights laws affect the operation of the marketplace? Provides a basic explanation of how the Americans with Disabilities Act, the Rehabilitation Act, affect those who are providing enrollment services. What do navigators need to know about disability? Deals with questions like how is disability defined? Why is understanding disability so important? What is disability literacy? What is disability etiquette? What is physical accessibility? How can navigators ensure effective communication with people with disabilities? And then how is Medicaid being determined for people with disabilities? Deals with, it begins the basic discussion of the Medicaid categories for eligibility for people with disabilities. The fact sheets then provide more detail on this and provide assistance then as you're trying to figure out these issues. There are 5 scenarios then of possible people you could meet, sort of give you a basic idea of things you need to be thinking about as you're meeting these different populations. And what type of accommodation should navigators know about? In reviewing, this basically reviews how to communicate effectively. The section helps navigators and enrollment specialists understand how they can be prepared to identify and assist individuals with visual or hearing impairments. And then the other things in the table of contents include a statement of our fact sheets, resources, and a glossary of terms. I mentioned this section earlier, so I won't spend a lot of time going through some of the questions about navigators and what they need to know, but this basically gives you a basic, sort of that real important area of some things that you really need to understand. I'll be getting into some of these issues later, and if you have specific questions, I would encourage you to follow up. I'm always happy to answer any questions people might have as it relates to disability literacy, disability etiquette, and those types of issues. As a person with a disability myself, I am more than familiar with these issues and can certainly help you sort of navigate those issues and make sure that you're responding in an appropriate way to these individuals. We do have different fact sheets, 17 specific fact sheets that deal with very different topics. So for instance, the first 3 of these basically really deal with how you get answers to a lot of the questions that we're going to be talking about, as well as then many specific areas, so rehabilitation and rehabilitation services and devices, prescription meds, mental health. We also deal with some of the Medicaid issues, such as the medically frail status, the process for Medicaid eligibility, referral and resources list, and the Medicaid buy-in program as well. And then we also do have one on disability etiquette, which I'll be talking about a little bit later as well. In year 2, we noticed in year 1 that there was a lot more use of some of the fact sheets that got into very specific areas. So what we decided to do for year 2, and then we've developed some of these since, is developing population-specific fact sheets. So in other words, what to know when assisting a consumer with and then a specific condition. So you can see the list of these fact sheets that are available. And if you're then meeting with one of these individuals, it sort of is in a very streamlined approach, and really they're all written with the same questions in mind, so that if you have a question about what this person needs to be thinking about when they're looking at prescription meds or doctors or whatever it is, you can go to this and it sort of gives you a basic understanding of these different areas. Now, we did notice in year 1 that there were several needs that existed. I'm not going to take a lot of time to go over a lot of these issues because I'll be dealing with them in a sort of a cursory way in some of the slides that follow. But I did want to put them all in one spot so you really sort of understood some of the issues that still do exist. The first one is one of the most common questions I get all the time from navigators, and that is in regards to assisting individuals who are deaf or hard of hearing, and how you communicate with those individuals. And basically, I'll be talking about this a little bit later, but it is an important question that people with navigators, when they're dealing with people that are deaf or hard of hearing, really need to be thinking about, so that they can deal with that issue ahead of time and not having to worry about it once the individual gets there. Another thing we did in year 1 is we realized that a lot of the focus for navigators shifted away from some of the technical issues that existed with the website, and more towards doing outreach for purposes of increasing the number of people who are enrolled. So what we did is we sort of created community outreach collaboratives, which are located in the states that you can see here on this map. We recognize that people with disabilities sometimes have a distrust of experts, that they don't perceive as having expertise with their disability. So we set up these community outreach collaboratives to sort of act as a bridge. So they are there to act as a resource for you if you have questions about the disability population and specifically some of the areas that they might deal with, because while some of these organizations are disability specific, they do have networks of other organizations that they can certainly refer questions to. And then they're also designed to flow the other way too, so that if people with disabilities are looking for help, they can then sort of channel them to a Navigator organization so that they can make sure that they get the assistance that they need. This is just a list of the COCs that we set up. For year 2, we had 11 of them, and then in year 3, we expanded it to include 18. They are located in 17 different states. There's at least one in each of the HHS regions. If you're interested in doing any outreach in one of those states, you can reach out to one of those organizations and they will be able to assist. Now, one of the things I always talk about when I talk about people who are dealing with have a disability and are looking at plans on the health marketplace, I like to refer to it as a game of health insurance Jeopardy. And because I say that because we know in the game show Jeopardy, it's not about the answer, it's about asking the right question. And that's really what the people with disabilities need to understand. And we do have a whole series that was dedicated to this. You can find this on our YouTube channel, which I'll be telling you about in a moment. But I do want to just go through some of these as examples of some of the things you need to be thinking about. So for instance, in prescription drugs, if the individual takes a prescription muscle relaxant, what question do you need to really be thinking about? Well, you need to be thinking about, does the qualified health plan have a tiered prescription medication benefit? We all know about tiers as it relates to you know, some sort of the generic name brand tiers, but then a lot of them also have specialty tiers, and understanding where drugs fall on this really could have an effect on the overall cost of the plan to the individual. Moving on to medical devices, this individual is a wheelchair user. Then you need to ask the question, does the qualified health plan cover durable medical equipment? I talked about one of the things the Affordable Care Act provides is it does require insurance companies to cover medical devices, but medical devices has never been a defined term. So it could mean different things. Some states have defined it, some states haven't. So it could mean something very different from state to state, and even in some states from plan to plan. So you really need to make sure you're looking at what the plan covers as it relates to durable medical equipment. And then the second part of that then is if the individual indicates that his condition requires he use a catheter, then the question you need to be asking is, does the qualified health plan cover disposable medical supplies? And that's also another very important area of what someone really needs to be looking at, because medical supplies are different than medical equipment, and the insurance companies may be dealing with those in very different ways. For rehab and rehabilitation benefits, the consumer uses rehabilitation therapy, and she says that she has to go repeatedly for it to have any lasting effect. The question you need to ask then is, does the qualified health plan put limitations on the number of rehab visits? Lots of times rehabilitation for people with disabilities is very different than what rehab is used for people that do not have a disability. Someone that doesn't have a disability, they break their leg, they go for physical therapy and rehab, and it's able then to get them up and back to where they were before. For people with disabilities, many times that's the same kind of service that's provided in terms of what the person actually does and who provides it. But for the person with a disability, they need to continue to do that for them to continue to really have the full use and have any effect of maybe the part of their body that is affected by the disability. In terms of Medicaid eligibility, Medicaid is so different from state to state. As a national organization, and we're not qualified to speak to Medicaid eligibility as it relates to every state. But one of the things that we do talk about is, you know, the basic question you come to when you're completing the enrollment application. So when you do complete the enrollment application on the exchange and you arrive at the question regarding disability, the question you need to ask yourself is, does the individual want to apply for Medicaid? Because what's going to happen is the individual is going to have, their application is going to be put into a Medicaid determination if you answer yes. So the person may have a disability, but it might be you might be better off answering no so that it doesn't get delayed for that reason. And then what will end up happening is they can just go ahead and enroll it. So if you know the person's not going to qualify for Medicaid because of their income or something like that, then lots of times it's better off answering no there, so it doesn't get sidetracked with one of those Medicaid determinations. For the summary of benefits and coverage, the individual is a wheelchair user, then you need to ask the question, does the summary of benefits and coverage say what the cost will be for services such as durable medical equipment? And that's really an important thing because, you know, lots of times cost for the plan, as many of you know, goes beyond the question of the just the premium. It's also the other costs that the people are going to encounter. So lots of times it's maybe more valuable to an individual with a disability to pay more in their monthly premium so that their out-of-pocket costs are considerably less. For mental health, I always like to talk about the great unknown when it comes to mental health, and that's why this slide is blank. The question you need to really ask for this is, does the individual need coverage for a mental health condition, as they may not self-report that to you? Unfortunately, mental health does have some stigmas associated with it, and people with mental health many times will not report the fact that they do have a mental health condition. And therefore, what you need to really do is make sure that you're asking questions that sort of get to that and try and figure out whether or not they do need coverage for these areas. The simple way to do it usually is by asking them what type of medical providers they see and what kind of drugs they take, because that may then lead to a discussion so that they understand that they need to make sure that those types of providers and drugs are covered by the plan that they're looking at. Double jeopardy round that we developed a year later deals with a lot of the specific disabilities, and once again I'll go through some of these relatively quickly. With intellectual disabilities, autism spectrum disorder, cerebral palsy, attention deficit hyperactivity disorder, seizure, and mental illness. The question here is, what are some of the common co-occurring conditions for people with intellectual disabilities? And you'll see that this is a common thread among people with disabilities, is they don't always just have one. There are many times other conditions that they do have to look at so that they're making sure that they're getting coverage for all of them. In terms of mental illness, lack of network adequacy, limited provider networks, lack of parity in coverage, high out-of-pocket costs, and wait times to see providers. In this instance, the question is, what are common issues that mental health people have with mental health treatment in qualified health plans? So it's just another thing to be thinking about when you're looking at these plans and making sure that they do have, the individual is going to be able to have access to the networks that they will need to be able to get the care that they need. For multiple sclerosis, of the 13 drugs approved by the U.S. Food and Drug Administration, which are available to reduce disease activity and disease progression, for MS, this is the number which are considered specialty pharmaceuticals. So we talk about the tiered medical benefits before, the generic name brand and the specialty drugs. All of them are usually considered specialty pharmaceuticals by drug plans, health plans on their drug formularies. And as a result, it then can become much more costly as it relates to the out-of-pocket costs. And those individuals then, once again, need to be thinking about whether or not paying a little bit extra in a premium is worthwhile to them. As it relates to paralysis, this is the difference in therapies between someone born with paralysis versus someone who's paralyzed later in life. And this is the difference between habilitation and rehabilitation. If you've heard the term rehabilitation, most people have, but not a lot of people have heard about habilitation. Habilitation is basically the same kind of thing, but it's for someone who never had whatever it is they're trying to get. So for instance, in this instance, we're talking about people that may be going to try and help strengthen their legs or something like that. For a person that is paralyzed later in life and maybe regain some use of their legs, that's going to be rehabilitation. But if someone was born with paralysis, then it's going to be habilitation because they never had that ability. Unfortunately, insurance companies many times pay for this very differently, and that's the reason you need to know the difference. For veterans, this is the number of groups used to determine who gets access to VA healthcare services, and this is what is 8. So veterans who the VA has rated at least 50% with a service-connected disability are placed in priority group 1, and veterans who receive a VA pension benefit, which are benefits for wartime veterans who are age 65 or older and low income, or if they're under 65, they're permanently and totally disabled, then these are enrolled into priority group 5. And that determines then who gets access to different services based on their priority group. Accessibility, I do want to go through these relatively quickly because I think they are all important. This is the one thing you need to think about when assisting a consumer with paralysis, and that is what is building accessibility, and that goes beyond just the way that the building is built, but also the way you have it set up, because a building can be built to code, but then once you start putting stuff into it, it can make it much more or much less accessible, and make it more difficult for someone in a wheelchair to navigate around that. In terms of assisting a consumer with multiple sclerosis, something you may need to think about for this individual is having materials available in alternative formats, because many times people with multiple sclerosis start to lose vision, and therefore they need things in large print. Not everyone with multiple sclerosis has that, but that is something that does happen to some folks with multiple sclerosis. Accessibility is something you need to think about with people with intellectual disabilities. And it is what is asking questions that verify the person understands the information. You can't really answer these questions many times in yes or no formats. Do you understand what I'm explaining? Because lots of times they'll feel pressured to say yes, even if they don't understand. So lots of times you're better off asking the person to repeat back what their understanding is, because that will really determine and show whether or not the person is understanding what you're explaining to them. One thing you need to think about when assisting a consumer with mental illness, what is educating yourself about mental health conditions? Like I said earlier, there are a lot of stigmas associated with it, and we want to make sure that those stigmas don't exist and really are limited, so that people with a mental illness are not and do not feel like they can use the services and really get access to the services they need, because they feel like they can't tell you about it because of maybe what they think you'll think about them. And then what is the one thing you need to think about when assisting a consumer who is deaf or hard of hearing? I talked about this a little bit earlier. I really want to underscore this point now, and that is, what is the individual's preferred method of communication? If they prefer to lip read, then let them do that. If they want to use an interpreter, then you need to find an ASL interpreter that knows sign language and can interpret for you. And they may just be comfortable writing notes back and forth, or even communicating via email, so that you can communicate that way and not have to worry about really trying to communicate in person. And then finally, the final jeopardy, I always look at disability etiquette. This is the one word that sums up the best quality you can have when dealing with anyone with a disability. And this is really a basic issue that you should deal with anyone, not just people with disabilities. And that is, what is respect? Respect is really the one word that really can sum up everything. Treat them as you would want to be treated. When you're talking to an individual with a disability, talk to them directly. If they have someone with them, don't talk to the other person. Many times it's very insulting to the person with a disability that you think that they can't understand it. If they want you to talk to their assistant or the person that came with them, they will usually tell you that. But just have respect for these individuals, and that will go a long way. If you do want to watch this whole presentation that we have on all the different areas, I just dealt with some of them. You can look this up on our YouTube channel, and they are in 3 to 5 minute increments that you can watch them, and it will allow you then to sort of deal with these issues and understand them, and they can be viewed in quick settings. Some of the ongoing challenges that we noted, some of these I've already dealt with in some of the issues that we, as I was going through the presentation already, but I do want to sort of underline it, because it is some of the issues that you really need to be thinking about when you're helping these individuals. So when you're looking at plans, look at the provider networks, make sure the doctors are included. Look at the drug formularies, make sure that they have the drugs that are on it, and that the pharmacy design is not set up in a way that's going to discriminate. You make sure that you're understanding what the habilitation and rehabilitation differences are within an individual plan, and then how all of this then relates to, for instance, the out-of-pocket costs that go along with that, and really judging what the appropriate plan is for the individual, whether paying a little bit more per month makes sense for that individual and their ongoing costs. When the Affordable Care Act was passed, like I said, there was a lot of important things that came in place for people with disabilities. After the election last year, we set up our 8 core principles that, as they were looking at repeal and replace, things that we really think they needed to be looking at. This is our statement. You can find it at the link that's at the bottom of this page that really explains why all of these are so important. And any plan that's come out, we've sort of judged it against this particular set of principles and whether or not we feel it adequately addresses those areas. The last thing I do want to have here is some disability etiquette slides. I'm not going to go through all these because I think I wanted to include them though so that you sort of had them in one place, that if you're looking at these afterwards, you can really sort of understand some of these issues. So some of these are basic understanding, you know, and once again, I said respect. If you have respect and you act on that, I think it will go a long way. And these are just some basic tips to sort of help you with those things, to deal with all people with disabilities, as well as people with mobility disabilities, people who are blind or have low vision, people who are deaf or hard of hearing and some of the issues that they address, and people with speech and language disorders and some of the things that they undergo as well. And then as well as cognitive or intellectual disabilities and some of the things that you can do for them. And then finally, mental health or behavioral health disabilities and some of the things you need to be thinking about as it relates to them. All of these are found, by the way, in the Disability Fact Sheet number 17, the Disability Etiquette Fact Sheet I referenced earlier. So I would encourage you to check that specific fact sheet out if you have specific questions. And like I said, as a person with a disability myself, my contact information is the end of this presentation. By all means, you can go ahead and reach out to me if you have a specific question. Some of the things that you need to be thinking about as it relates to disability, accessibility, and accommodations. Parking lot accessibility, making sure that, you know, where the accessible parking is cleared and the person can get to a sidewalk or whatever they need to do to be able to access your building. Building accessibility and ramp accessibility. If someone needs to, if you're in an older building that has stairs into it and there's an alternative way to get in, make sure that there's signage that directs them and they can then easily find where they're supposed to go. Also, meeting room accessibility. If you're in a meeting room and you're making sure that it's cleared so that people with a disability in a wheelchair can get around, or someone that is blind isn't going to have a lot of obstacles that they're going to have to go around. Making sure restrooms are fully accessible, having things available in alternative formats. The packaging and messaging of materials is also very important because we want to make sure that people with disabilities feel included. So if you can include people with disabilities in your messaging, then that will sort of signal to people with disabilities that they can come to you for assistance. And then font size, making sure that things that you are preparing and distributing are done in a way that people will be able to read it easily. If you're interested in staying involved in our project, I'd encourage you to go ahead and check out our website to receive updates. There's a place there where you can sign up to receive our weekly newsletter that comes out every Friday. The archive newsletters for that are at the link there. If you want to sign up for my organization's newsletter, which comes out, you can do that at the website, at our main website. And then we also have a resource center that has a lot of other helpful tools that you may want to check out that you can find there. At this point, though, I'll go ahead and open it up and see if we have any questions.
Perfect. Thank you so much. So if you have any questions, just type them into the chat box. And again, we will distribute the slides and a video recording of this presentation, so you guys will have all the links in the presentation. A few of the links are in the chat box right now, but if you can't access them, we will send around the slides as well. So we have one question. I have not seen any insurance plans which cover hearing aids except for the pediatric age group. How does this jive with the ADA?
That's a really good question, and that's been an ongoing problem that we've had as it relates to coverage of those. And a lot of that has to do with the fact that insurance companies many times follow what Medicare pays and doesn't pay for. You know, that's they sort of go hand in glove there, and they have started you know, covering some of that, but it does get many times very difficult for that coverage to exist. Whether or not that specifically, and this is one of those areas where once again the ADA does not apply to healthcare, so it doesn't really fall within the ADA jurisdiction. It would really be an issue of whether or not it would be in violation of Section 1557 of the ACA. Section 1557 is the civil rights provision of the ACA, which extends the protection of not just people with disabilities, but a lot of different areas for race, gender, gender identity, all those areas that are covered and that insurance companies can't discriminate against. So I'm not aware of any specific challenges that have been done to that, but if it were to be done, it would be done under Section 1557 of the ACA and not the Americans with Disabilities Act.
Perfect, thank you. And it looks like that's actually all the questions we have. So if anyone has additional questions, if you think of anything, if you have more of a private question or a more complicated question, please email myself or Carl. Both of our contact emails are on the screen right now. A couple of words in closing. First, a huge thank you to Carl for presenting today. We really appreciate it. We just having more comprehensive resources on topics that we do not have expertise in is really, it's just really helpful that that he presented for us today. As a reminder, we're going to be distributing the slide deck and a video recording of today's presentation in an email in the next week, and we're going to post everything to our Beyond the Basics website at healthreformbeyondthebasics.org. Oh, also, we just got a question in, so do you mind answering one more question?
No, go ahead.
All right. So to confirm, if a client is receiving Medicare, are they still eligible to apply for marketplace coverage?
The answer to that question is they are eligible to apply for it. They're not eligible to receive premium tax credits for it. Anyone can get coverage under through the exchange. The question always is, who's paying for it. And if someone's looking for premium tax credits, you cannot get premium tax credits if you already have minimum essential coverage, which Medicare is considered to be minimum essential coverage.
Perfect, thank you. And again, if you have additional questions, please email myself or Carl. So we'll bring this webinar to a close. Again, all of our materials for this Beyond the Basics project are posted to our Health Reform Beyond the Basics site. And please also visit the National Disability Navigator Resource Collaborative as well. There's a link at the bottom of your screen, and we'll send all of the links that were within this presentation to all of you guys in a follow-up email as well. Again, please stay in touch. Thank you again for joining us today, and good luck with open enrollment next week. So thank you so much.
Thank you.